So the next part is how you protect privacy. Let me remind again that security privacy, security is about CIA, whereas privacy is about how you let the person control the curtain. So in this case, hospital patient care data, you let the patients control the data themselves. Let's say, for example, if you want the data to be used for research, you need to ask for consent. You need to have some process in place to protect privacy and let the patient control how much to reveal. So, of course, security safeguards are privacy safeguards because it helps protect confidentiality of the information, and so you can decide, as a patient, you can decide whether to close or how much to close or open the curtain. Informed consent as a process to allow the person to decide for themselves whether they want to reveal the information for research or for other purposes to several parties, for example. Sometimes, like in healthcare, in patient care setting, once the patient gave initial consent when they came to the hospital for treatment, we share the data across the hospital departments. That is necessary. Sometimes it's not possible to limit how another department can see the data because that's how we work and we take care of the patients together. But if we use the patient's data for something else, like research, or to reveal it to the public, that actually should require consent, unless there is a law allowing that as an exception. And also you need a privacy culture, a culture that cares about confidentiality and privacy and respects the patient's privacy is key, because without that, then people don't really care, and so it's really hard to protect secrets in that environment. We also need to build awareness of the users. As I said before, once you build awareness of the users, they will be more concerned about security and privacy, and they will be careful about the information or even the reused papers that they have, how people access the information. Once they are aware, they will be very careful. There should be an organizational policy on privacy as well, what's the process of revealing the data to the public, confidential data, or the policy on how you provide consent or ask for consent from the patient, how you enforce that, and how you assess security and privacy risks and monitor that as an ongoing process. So you see, privacy safeguards, most of them are not technical safeguards. Most of them are policy and administrative in nature, whereas security safeguards, they include not only administrative or management policy-related measures, but also technical measures as well. Okay.